Progress to Health is a community-based health and disability support organisation. We're based here in Hamilton but provide service throughout Waikato, Taranaki and Taupo and have the strategic direction and plan to spread geographically across the nation. The work we do supports people living with disability and long-term health conditions, in particular mental health conditions, to understand what it is that they want to do with their lives and derive a plan and then help them achieve that plan. Our social enterprise is PressGo, and that's come about by the realisation that we can provide similar support to small businesses, particularly family-run businesses, as we do to individuals accessing our services. We first started thinking about social enterprise back in 2005. It started off really as some vague conversations around what ifs. Could we do this? What might it look like? We then had to agree what our definition, particularly with the board members, we had to agree what our definition of social enterprise was. We very quickly agreed amongst us that for us, social enterprise meant a business for social good. And then from there, looked at our contracts, looked at our funding and said, okay, that will sustain us for so long, but we need something different. We need something new. The original idea of PressGo was to provide individual solutions to small businesses that were facing difficulty with the wellness and the well-being of their company. We're probably still on track with that thought around creating healthy and vibrant workplaces, but we're probably growing up and maturing and probably, as we go over the next couple of years, distilling that down maybe into a more targeted market and menu. Wellbeing and mental health is important to business because if you think about the old airplane adage of looking after yourself before you look after somebody else, you need to understand what your triggers are, you need to understand where your stress levels are so that you can look after yourself, and then you can put strategies into place for looking after your staff. We pretty much respond in terms of products and services to the individual need of each company and each customer. In essence, the benefit that our customers get seems to be relief, that there's someone there that's actually able to do what they're wanting us to do. The concept was very simple. We were already providing service to individuals, so that was a translation of what we were doing into a business setting. So probably the first challenge was actually putting our business hats on and saying, now we're doing this to create $1, but obviously we had to make sure that we were improving the business's life to get the $1. Our product is shaped entirely by our customers because we tailor our response to the customer need. We made it very clear from the outset that we weren't going to have a product on the shelf that we would just pick off and make you fit. So we may take a little bit out of the box, but the rest we will craft for the customer. So everything is in response to what the customer needs. We grew our customer base by word of mouth, essentially. As soon as we knew that PressGo was a goer, it was a case of talking to people, starting with our collegial agencies, our colleagues, our networks, and then from there, word of mouth, started getting the customers in. And we've had a broad range of customers from, as I say, collegial agencies, other community organisations, right through to government ministries, and everything in between. So again, we've proven our mantra, if you like, of a tailored response to the need of the customer. Our governance structure through our board for Progress to Health is very clear in the sense that Progress to Health is our core business. It's the reason we exist, and PressGo therefore has to make sure that it's supporting the work of Progress to Health, and the priority then is self-determined. The growing success of PressGo, I think, is initially attributed to our staff and the way that we work in Progress to Health. We bring Progress to Health's team along with us because they understand that if we have a stronger revenue income, a stronger revenue stream, that they'll have the ability to put up ideas and suggestions of how we can grow our services, how we can meet the need of say, rural communities or youth or elderly people, so that they can then contribute to the growth of the organisation as well. We've already got the philosophy there, and we've translated that philosophy into PressGo and taken the skills and capabilities and learnings that we've had over the last 21 years into this new entity. We have huge ambitions for the future. Our strategic goal is around increasing our revenue to in excess of 5 million over the next few years. So from that point of view, our goal for PressGo has to be sustainable revenue income, and that it will become its standalone entity so that it can go and run its own business and we can look to the next thing. The new skills we're particularly looking for are the ones that we have already identified that we don't necessarily have. We have exceptional expertise in terms of mental health and wellbeing. We know how to talk to somebody around reducing stress, for example. What we don't necessarily have is the other side of the coin, which is the physical health. The one thing I probably would have done differently when I had my bright idea way back when, was probably sat down and been a little bit clearer around the planning side of it and who was going to be involved from the start. That morphed into a decision rather than a black and white discussion and decision-making process. So I'd probably revisit that again if I had to. If you're a not-for-profit organisation that's considering social enterprise, not really sure where to go, the key piece of advice I was given was look at what you're already doing, because chances are part of your service already carries something that will translate into the commercial setting. Start there, talk to people. If someone else is thinking about starting a social enterprise, I would say be brave and go for it.